Hi there everyone, my name's Alexa. I am a hip dysplasia warrior. I had a peri-acetabular osteotomy on my left hip about 7 months ago at the start of 2019. I also happen to be a running coach and a sports massage therapist, and today's video is following on from the previous video that I posted about the things that you've got to look out for when you return to run after surgery for hip dysplasia, or running, whilst you're at any stage of your hip dysplasia journey really, and the things that you need to look out for. And I mentioned that I'll be covering a few exercises to work on, so this is that video to cover those different exercises. Obviously, bit of a caveat before we get started, and that is you really do need to have your surgeons sign off, or your consultants sign off before you start running. So bone healing, particularly post-operatively, if you've had a PAO or a replacement or anything like that, is incredibly important. So you don't want to be introducing a really kind of high impact, repetitive loading sport like running too early on in your recovery, because it can impact how you heal from your surgery, both the bone and the muscles. So please also check in with your physiotherapist as well. As I mentioned in my last video, there's a good kind of rule of thumb, and that is don't run before you can walk. So make sure that your walking gait is good, is perfect. There's no limping, there's no swaying, there's no Trendelberg gait, which is where your hip drops to one side and you lean to the other side as you're walking. So you want your walking to be absolutely spot on before you move to running. Running is essentially the same thing, but with much higher forces. So you want to make sure your muscles and your bones are really happy to cope with that. So a few different things that we can look at from a running point of view. I guess the most interesting thing about running compared with things like cycling, swimming, walking, is that you only ever have one foot on the ground at a time, or you're in the air. So a lot of one-legged stuff is a really, really good place to start to see if you're in a good position to return to running. So standing on one leg as a basic one. How long can you stand on one leg without any wobbles? If you're having a bit of a around, or your hips are dropping like that, then this is something good to practice on whilst you're making a cup of tea or coffee, whilst you're brushing your teeth, whilst you're standing waiting in a queue for something. Making it then more difficult by spelling your name out in nice big letters with your other leg, shifting your centre of gravity around a little bit. And then the final one, if you feel like being a bit of a Jedi at standing on one leg, is doing it with your eyes closed. There we go, not quite there with that one myself. So it's a really good way of practicing and increasing what's called your proprioception, which is your awareness of where you and your body is in space. Often when we go through surgery, and particularly that sort of proprioception just gets a little bit knocked off course somewhere, so your body has to learn the new position of the hip joint and how things are working. So standing on one leg throughout the day as often as you can is a really good place to start. Once you've kind of got into standing one leg, and hopefully, I'm assuming here at this point that you've progressed a decent way down your physiotherapy pathway in terms of range of motion, strength, and started to do some maybe more challenging exercise with your physiotherapist, is starting to do stuff while standing on one leg. Now I'm going to try and do it on my slightly not so happy side, my left side, and see how I get on. So the one leg knee bends that I talked about as a little bit of a test, can you control that inward knee roll? If you can, are a really good exercise to start doing. A mini squat. I don't normally go down too far with these, because to do a one leg squat properly is quite challenging, but just controlling that knee, making sure that that knee is pointing straight forward. So if you had a torch or a headlight on that knee, the light beam wouldn't be moving inside and out, it'd be staying straight ahead all the time. Another thing you can use are these wonderful TheraBands. I love these. I've got a collection of them tied to various bits of furniture around my house, and use them for various different physiotherapy exercises at different days of the week. Either around your knees, or if you want to make it more difficult once you've got used to these exercises, around your ankles. So starting with the feet hip width apart, a little bit of a bend and a bounce in those knees. An easy way to cheat is to straighten and lock out the knees, so keep that bend and that bounce, and we're just stepping out and then stepping that leg in again. So stepping out and stepping in again. You should start to feel it a little bit in your glutes doing this. And another top tip, other than to keep your knees bent throughout, is when you're bringing this leg back in again, sort of resist the pull of that elastic band. Don't let the TheraBand ping your leg back in again, nice and slowly and controlled back in again. You can progress this by making this TheraBand a stronger, sort of thicker, higher resistance band, by moving the band around your ankles, longer levers. And another one I quite like doing with this one, shifting your leg onto one foot and just moving the leg, tapping the toe on the ground, moving the leg out to the side, or out and backwards at sort of a 45-degree angle. I particularly like this one, it really feels like it's doing something. You'll find with this one, it actually ends up working the leg that you're standing on almost as much as the leg that you're moving, which I find quite nice. All of these are exercises, by the way, that I work on with runners of all sorts. I think weak glutes tend to be a bit of an interesting challenge in our society because we spend quite a lot of time sat down. So these are exercises that I find that I'm working on with quite a lot of runners, hip dysplasia patients or not. The final one is that you can add instability into your exercises. So this is a Bosu ball, like half a gym ball, put on a bit of a plate, and I do quite a lot of exercises on this. So anything that you might be doing, introduced to down the gym, or maybe that your physio's given you, you can also do on a Bosu ball. So I do my squats, whoop. It adds a bit of a stability challenge. So I do my squats on a Bosu ball, because it means that my stabilising muscles are working that much harder. You can feel my ankles working harder, my stabilising glutes working harder. So it's a really good way. You can even just stand on it, upturned, so you might not be able to see my feet there, but I've got it this way up, so the plate is on the floor, and the ball is up in the air. Often when I'm doing upper body exercises, I'm just stood on the Bosu ball while I'm doing them. If you don't have a Bosu ball or don't have access to one, you can get little small wobble cushions. They're inflatable sort of rubberised wobble cushions off the internet. Or a kind of more basic solution is taking a big sofa cushion off the sofa and standing on that, just providing a little bit of extra instability under your feet. So those are a few ideas about how you can improve your balance, your stability, and the strength of some of those stabilising muscles, particularly around your glutes and your hips, and your ankles, which work quite hard when you're running, to help you on your return to run journey. Hope that's helpful. Happy running.